Only few days are left for the INICET exam. Now you are confused from which source to study, what to study in this last few days. And remember, this last few days is going to determine your rank in the INICET exam. During my INICET exam, I was in my internship. I didn't get that much of time to study, but still then I didn't focus on certain important topics and certain important strategies, due to which my rank slipped from 29 to 684 in the INICET. I don't want you all guys to repeat the same mistakes. I have analyzed those mistakes and I am going to bring you what you should actually study to get a top 2000 rank or get a rank with which you can gain confidence. So 23 days are left. If you are watching this video a bit late, you will have 12 to 13 days left. Just overview the RR just by passive reading. No need to focus on active recall at this point of time. Okay, use RR or the source you are using. Last 7 days, stick to only the previous year topics, because remember, in the INICET, direct repeats from previous year topics is 10 to 15 questions, and from the previous year topics 120 to 150 questions is going to get repeated in the main exam. So last 7 days only PYTs. Last 2 days mark your volatile PYTs, go through them, and the bookmarked MCQs of your Q bank. Remember that the whole year you are preparing is that you can revise in last 10 days of your preparation. So this last 7 days plus 2 days becomes very vital. You will have to revise all the previous year topics, then only you are going to get your desired rank. Now coming to how to study PYT. In this case, we will have two groups. One group who are focused more towards the NEET PG, those who have less time, want 2000 to 10,000 AIR to boost their confidence or get some branches like PMR and community medicine, pathology in the central institutes, and they have not solved all 8 years of previous year questions of INICET and 3 years of NEET PG. This is one group. Another group is they genuinely want a seat from the INICET and a clinical branch of their choice. So they want top 2000 AIR, and they have solved 8 years of INICET questions and 3 years of NEET PG questions, and they are ready to give the extra effort what I am going to tell you, which I haven't given. That's why my rank slipped to 600. Those who have target 2000 to 10,000, I will request you to go through my previous year topic list. It has a strike rate of 140 in INICET November 2025. In INICET May 2025, it had a strike rate of 126, and INICET November 2024, it had a strike rate of 151. So link is given in the description box below and pinned comment section. You can check it. In this time, you will have to highlight all the topics. Some of you ask me that whether you have to study all the topics or the highlighted ones. The highlighted ones are more than one times repeated questions, but you will have to study all the topics, because from all the topics only the strike rate is 140 to 150. In topic, if it is missing, then use ChatGPT. Don't use any other AI. I have used all kinds of AI starting from Claude, Gemini and Grok, but for medical preparation, ChatGPT is the best. So tell ChatGPT write the topic and to explain it further for the INICET perspective. You will get the important points and add the important points in your source. Now coming to those who want something extra, a top 2000 rank. So you will have to practice 8 years of INICET, 3 years of NEET PG previous year questions. Why 3 years of NEET PG? I am coming in the further slides. First thing is you will have to annotate it in your source of revision. Like I had annotated anaphylactoid reactions was an extra topic from AIMS, so I had added it extra. Like this, if you annotate in the last 7 days, it is easier to revise all the highlighted points you are going to see. It is going to make a photographic memory in your brain. So annotate the extra points in your revision notes. If you can't annotate, bookmark the MCQs, and you are going to review those bookmarked MCQs just 2 days prior to the exam. Another thing is, why is NEET PG previous year questions important? Because if you see this question, in the given histological image, the region marked by arrow can influence adjacent cells, primarily through which mechanism? If you don't know the image, this image was given in NEET PG 2023. That's why questions of NEET PG are repeated in a certain way with greater depth. So the same image is being repeated in the INICET. That's why past 3 years of NEET PG is also important. And if you are having problem in image based questions, you can go through my digital image bank pro, all 19 subjects, 1850 plus images. It is now at a discounted price. The link is given in the description box below and pinned comment section. Now this time it was easy to rule out the options because आस पड़ोस में जो influence होता है तो उसको पैराक्राइन effect बोलते हैं. Now you will have to analyze the MCQ. This time they ask paracrine, so they can ask autocrine, endocrine, neurocrine, juxtacrine, holocrine secretion, merocrine secretion, apocrine secretion. This is the studying of the previous year topic. That means you know that they have asked paracrine effect. Now in future question, what they can ask in the future years in May INICET 2026, these are the things they can ask. So you can go and ask through ChatGPT, or you can join my Telegram channel and WhatsApp channel. I'm going to share certain images which are important for INICET and NEET PG aspect. The link is also given in the description box below and pinned comment section. Another question, this is of INICET May 2025. This was difficult to attempt with the short forms given. Which law provides legal framework for ensuring medical data protection and privacy in India? PNDT is Prenatal Diagnostic Test Act, and HIPAA is foreign. DP is Digital Personal Data Protection Act. So this is the answer, and GDPR is also for the European Union. Now from these two acts are of India. That means this has a potential to come in the future exam. Now I searched in PCPNDT Act. In the ChatGPT, it has given all the background. After that, it has given imprisonment of 3 to 5 years. That is also important. It is used in ultrasound clinics. It is used for genetic counseling. It is used for lab performing the prenatal test. And in Digital Personal Data Protection Act, it deals with the digital data processed. Principle is individual and consent based processing. So any question from these topics could be asked in the May INICET 2026 or the future INICETs. So you will have to analyze the previous year topic and you will have to search it in the same way in the ChatGPT. And 20th notebook, if you haven't made, this is not the time to make the 20th notebook. You have highlighted all the previous year topics in your main source which you are studying. No need to go for FOMO and apply for new sources. Just highlight the volatile previous year topics with a different kind of ink. See those topics only in the last 2 days. And INICET May 2025 analysis, if I say, then with 160 corrects, it was a top 10 rank, 150 corrects, top 100, 140, top 1000, 135, 2500. That's why if you practice only the previous year topics with depth, you are able to get at least 120 questions correct, and some of them you can get correct from your applied knowledge and ruling out options also. 130 corrects 4000 rank, 120 corrects 10,000 rank, and 110 corrects 28,000 rank. FDA approved drugs also you should study, because 1 to 2 questions usually come in FDA approved drugs. You have asked me to prepare one list. I am not sure whether I will be able to make it or not, but do subscribe to my channel, because if I make it, I will release a video regarding that. In FDA approved drugs, you should learn the drug, the mechanism of action, and the indication it is used for. Now INICET essential CDC life cycles, and monoclonal antibodies notes are present for free access. The link is given in the description box below and pinned comment section. If you haven't watched the last 30 days strategy for INICET, then go watch it now. And how is INICET different from NEET PG? And do subscribe to my channel because we are very soon to hit 40k subscribers. All the best for your INICET exam.